Oh, hey, good morning. Hey, Amy, how are you?
Hey, good, Sean. Nice to see you. It's been a
Good. I
while.
was, I wasn't realized we were heading. I thought it was a different day, but that's okay. We're good to go. I was, just getting ready to. I'm just in the middle of cooking a big old brisket. So I was up. I started yesterday at 5 a.m. and then it kind of went all day, and then I was up. I had to go and take care of it at 3 in the morning, and then 5 in the morning, and then 7 this morning, and then I put it in, wrapped it, so it'll be ready for this evening. So it's been like a 30-hour deal. It's been quite a
What do you have to do? Are you flipping it? Are you basting it? Like, what are you doing at
Yeah,
this
you kind of
time?
have to. You kind of have to, keep it moist while you're cooking because it's smoking. So it takes,
Yeah.
anywhere from 12 hours to 30 hours, depending upon how slow you do it. And I'm doing it very slow. And I think I just got the smoker, and I'm figuring out. So I figure if I can get one done in one day, I'm gonna have to get up around 2 or 3 in the morning to start it, and then I can deal it with that. But if I start it too late, like I started at 5, then it's not ready by evening. So then I just have to kind of keep it slow overnight, and then so
Yeah.
keep babying it. So anyway,
Yum.
I had a disjointed sleep last night. He set my alarm every 3 hours. My dogs were looking at me like, "What the hell's wrong with you, man?"
Well, I'm sure it's going to be worth it. Let's hope so anyway. It
Oh, it
sounds
looks
like it's going
great.
to be worth it.
Yeah, it looks great. It's going to be really, really good, and it's
Yeah.
something that I find brisket to be real nice. Amy, where do you live these days? You look like you're up in the clouds. Maybe I'm not sure
Oh,
where.
this is a painting. I'm in Durham, North Carolina, and I live in an apartment. I wish I could have a smoker. I mean, I don't know anything about it, but I will learn someday when I have someplace where I'm allowed to have a smoker, you know?
Yeah, yeah. I mean, I haven't had one. Obviously, I've been the carnivore guy for 5 years now, and I mean, I've been waiting to get one. We just moved up here to Washington State, so we're on a little bit of acreage, and we got a big back porch. And so I said, well, I'm gonna throw a smoker around there, and so we did that, and
Yeah.
it's been awesome. Family loves it. I've been smoking everything. I mean, it's kind of like, anyway, it's a lot of fun. Well, tell me, Amy, what's the latest with you? What's going on? How's life? Well, I know you guys had the book with Eric Westman, and I know you've been just an advocate for non-insanity. I mean, I think, because obviously, we all get frustrated when we see some of the extremes that people sort of take stuff to, but what's up with you? What's the latest?
Yeah, I'm still doing that stuff. I mean, it's despite our best efforts, it's only getting more and more extreme and more nuts. And I feel like sometimes I get so exasperated that I'm like, I can't do this anymore. I got to find a new career. But then I think, no, that's exactly why we need to stay. Like our kinds of sane voices are, I think, probably needed more than ever. But the very latest with me is I was supposed to speak at Low Carb San Diego, and I sort of reneged several weeks ago. Like maybe I gave them enough notice. I backed out because I realized I felt like I was out of things to say, or like out of anything new to say. I have plenty to say to lay people about practical implementation of low carb or ketogenic kind of diets, but to get on stage and give a talk that's approved for CMEs, and I feel like I have nothing new and groundbreaking to say, so I'd rather wait. But then I just, like literally yesterday, realized that I just need to stop talking about keto because my latest project that I'm just starting to work on is something related to thyroid. And of course, so many people go on a ketogenic or carnivore diet and their thyroid problems go away. And that's great, but that doesn't happen for everybody. And there's so much mistreatment and misdiagnosis and undiagnosis of thyroid problems. And I'm going to have to, like, I'm going to just wrap it up because the point is there's so much unnecessary suffering out there. And so my next project is to educate a little more on thyroid. And I just realized, oh my God, I could have given a talk about thyroid, but that'll just, hopefully I'll get invited to more conferences and that'll be like my next round of talks.
Sorry, I muted myself. So I was going to say that's awesome to hear, and I know you'll do a great job of it. I know, like I said, your work on Alzheimer's was really, really well done, and you can. I don't know if you continue to do your little blog post writings. I know you like doing that, but so I'm sure the thyroid will be comprehensive and very helpful and help tremendous amounts of people. You talk about it being underdiagnosed, and it seems to me, like I said, when I was actively seeing patients, I saw so many people on thyroid replacement. It was like it was everybody. It seemed to have it, and yet, um, what are people missing with thyroid that you see is pretty common?
Yeah, it's funny you mentioned what you said, because not only is it very often unrecognized and undiagnosed, but even when people are on the medicine, like, so some doctor somewhere was aware there's a problem here, they're on thyroid medicine and they still feel terrible. So clearly that type, like, there's a lot of different kinds of thyroid medicine, so clearly that kind or that dose is not working. And people really do not know how to be their own advocates. They don't know how to go to the doctor and say, I've been taking this medicine for a month, but I still have all my same signs and symptoms. Like, could we maybe try something else? But I think one of the biggest problems I see is, just like we see in the metabolism world with things like blood sugar or insulin or whatever, the normal ranges are not really that great. They're not that great to go by. So somebody could fall within the normal range for something like T4 or T3. But if they are wildly symptomatic off the charts, who really cares what the number is? That's, I think we see that all over in the healthcare world, treating numbers on a page instead of treating a human being, like the art. I mean, I'm not a doctor, but like the art of medicine, the practice of medicine, rather than just, well, here's what the algorithm says and here's the number, here's your medicine.
Yeah, and I agree. You see that all the time, and it's interesting when you look at data compared to looking at quote unquote objective data versus subjective data. With patient-directed outcomes and physicians-directed outcomes, they're wildly disparate. Physician will say, "Well, this patient had a great outcome," and then you talk to the patient, they're like, "No, I didn't. I still everything still sucks." So it's kind of interesting that you see that.
And I personally have been very fortunate to have good doctors that I felt like I could trust, and maybe they knew what I do, so we could maybe have a conversation on a different level. But why is it that, and I heard this from a physician, I didn't come up with this notion, but why is it that, depending on your kind of doctor, like, the minute your blood pressure is even a little elevated, the minute your cholesterol is high, you're going to leave that off with a prescription, and you practically have to kill somebody to get thyroid medicine. Like, the last thing they want to do is, God forbid, give you some damn thyroid medicine. But you'll get a statin within 2 seconds. You'll get blood pressure medicine. You'll get metformin, and you could. And I don't want to stereotype, and I don't want to be a conspiracy theorist, but this same doctor that told me this, like, it's so hard to get thyroid medicine compared to everything else. Men are not immune to thyroid problems, but women are much, much more susceptible for whatever reason. And so when you've got a fat, depressed, down in the dumps sort of woman sitting in your office, I think we get taken less seriously than if a man were to come in and say, "Doc, I'm tired all the time and I'm depressed and I've got this and that." And I don't want to believe that that's true, but maybe that's one aspect of it.
Yeah, certainly, I think we're learning, differently how women and men respond to stuff, and there's definitely different perceptions and biases depending on who the provider is, obviously. Let me ask you, with the thyroid stuff, this is one thing there's a lot of Hashimoto's thyroiditis, which is obviously an autoimmune issue, and we know for whatever reason women tend to be more susceptible to autoimmune diseases. If you look at across the board, RA, MS, on and all these autoimmune diseases, women predominantly affect women. It's not that men don't have them. There's some that men have it pretty equally, but mostly it's women. Why do you think that is? Do you think there's anything? Is it hormonal differences? Is it lifestyle differences? Is it pregnancies? I wonder what do you have any thoughts on that?
Yeah, I really have no idea. I've heard it very probably is hormonal. I think there are some links to estrogen, which of course is going to affect females more than males. So I think there's a hormonal aspect to it, but I don't know if anyone really knows why women are so much more affected by these things. But and there was something else that I just fell out of my brain. What was it? Oh, that, things like, if anybody here with us is familiar with the condition lipedema, sometimes lipedema, it kind of comes on, and it's triggered sometimes at puberty, after pregnancy, or at menopause. So these times of very rapid hormonal change bring on this thing. So I think that probably has a lot to do with it, but what the actual mechanisms are, I wish somebody knew, because I don't think we do know.
Well, I'll put my conspiracy theory in here. It's noted that women tend to eat far more vegetables than men, you know, and like I
And
said,
less fat, less red meat,
yeah, yeah,
honestly.
it could be. I mean, there could be a dietary cause. It's
I will
kind of
say, like, I think we all know that with the autoimmune conditions, a lot of people do tend to get much, much better on a carnivore diet or a keto low carb diet. Not everybody does, and not all thyroid problems are autoimmune. That's only one of like a huge umbrella. But I do see a lot of Hashimoto's get better with keto or carnivore.
Yeah, that's been my experience too. So, um, what is so? Have you seen? I mean, obviously, there's been I guess in the last few years, most have seen. I guess when I started talking about the carnivore diet, meat became more popular. Not everybody's doing carnivore, but that became less demonized within the low carb communities. And now it's kind of like people are sort of, when Ted Naiman's getting there, people are more protein focused now, and so we're seeing these evolutions. Are you seeing any other changes that are coming down the line with regard to this I mean, obviously in this low carb, we're all in this kind of this bubble, and we all kind of, have our own little particular bias on that. But I mean, there's some overall trends that are happening. Do you see anything else that's taking place?
Yeah, I see people like coming back from, I'm going to use a word, but then I'm going to clarify because I don't want to offend anybody. People coming back from the extremes. So people that just so something nice to come out of what Ted Naiman is doing is that this wackadoodle fear of protein that people had years ago is starting to go away. People are like more and more protein, which is nice to see. But it's also nice to see, frankly, people not be so terrified of carbs. Now, I know this is a carnivore community, and I'm not saying by any stretch that everybody needs to eat carbs or that everyone should eat carbs. But there are some people who feel better with a little bit more carb. And so it's just like we went so far in demonizing all fat. Then it was just saturated fat. Then it was red meat. Then it's always something. And it's nice to see, like, people will gravitate toward an extreme, whether it's an all meat diet, an all plant diet, a super strict keto diet, whatever it is. They'll feel really great for a while, but then over time, they'll kind of move slowly back towards something else, which there's no good or bad. There's no better or I guess the point I'm trying to make is I see people being more willing to change things and find what works for them. Because even if something like carnivore or keto or whatever worked really well, maybe you get to a point where, I don't know so much anymore, and you move like a little shift over. Not that you'd go from like a carnivore diet to a vegan diet or anything like that, but I guess I see people being more okay with learning what works best for them rather than like following what somebody else said to do just because they're famous and they said to do it. I think a lot of people start there, and then over time they'll tinker and just do what's best for them.
Yeah, and I think that's the theme that I've talked about all along. It's results based and do what's going to work for you. And many people find a carnivore diet, they use it as an elimination. They fix whatever underlying issues there, and then they find out later, hey, I can tolerate this, and I'm fine with that. And I think the nice thing is most people don't go back to the standard junk diet that usually got them in the situation they're in. So you kind of solve that. Now, to be fair, there are some people that have tried to add back in and they just don't do well. But equally, there are people that, hey, they're mostly meat based, and then they have some fruit every once in a while, have some mushrooms, maybe they'll have a little bit of vegetables here and there, and they're also fine. In fact, the data we had on something like 12,000 people, we saw, when we did the survey data a little while ago, we saw that, as you progressively got more and more strict, the results got better, but it started to taper off, kind of asymptotically kind of close off. So by the time you got to 90%, you got 98% of the benefits. And then that last two maybe benefited a few people that were suffering from severe autoimmune gut dysfunction, Crohn's and stuff like that. And so there is definitely some room for, do what works for you. We're not I don't have an ethical ideology tied in this. I'm not here to save the tomatoes or whatever. It's just like, it's just, eat what works for you. And I think, if you look at Ted's approach, which many people are supportive of, this carnivore diet is low in junk food. It's high in protein. It's high in good quality nutrition, and for some people it doesn't irritate the gut like some of the other stuff. And so we have a nice community here. And I think most people in here are probably very accepting of the message you have. We've got a few folks that are pretty strict and they stay that way, and that's fine too.
I think my message is like, do what works for you. I don't have a message like carnivore keto. I've had some clients who were doing ultra strict keto, and I'm like, I think you need more carbs. And then I've definitely recommended the carnivore diet for some people that really had those kind of like intractable, really mysterious kind of situations. And I'm like, we need to just get back to square one, eliminate everything that could be causing a problem. But one thing I do want to say, and I feel like this sort of venue is a little more friendly to it maybe. And I've said this on my public YouTube channel too. I absolutely adore Ted Naiman. I do. I've learned so much from him, but I just hope, and this, I'm going to make a prediction. I'm going to be on the record here predicting this. If this comes to pass, it's not going to be his fault, but here goes. I predict that people are going to go back to being terrified of fat, because now it's like protein, people are eating fat-free mozzarella cheese, fat-free Greek yogurt, and that's fine, do that. But I hope that over the long term, people don't go back to being really, really afraid of fat like they used to be. And if they do, Dr. Naiman has never said eat zero fat. Like, he's been very clear about that. And it's funny because I see this with you, I see it with me, I see it with Ted Naiman, I see it with like even Dr. Stephen Phinney, with all these people. You can say something that's very logical, very sort of sensible, but the people listening will extrapolate the weirdest interpretation of it, right? So for Ted to say, hey, if you're really, really struggling with fat loss, maybe don't put butter in your coffee, maybe cut back on fat. People hear, oh, I can never, ever have fat ever again. I have to eat fat-free everything. Like, that's this extremist interpretation that we see. I predict this is going to work really, really well for some people, but over the long term, it's going to backfire for others, but it's not going to be his fault.
Yeah, I mean, that's fair. And I mean, in my book, I specifically talk about people using carbohydrates, particularly athletes and stuff like that. So I've never been anti-carb, and I'm still not that way. I think some people don't tolerate certain foods, and I think that's the basis of this. But yeah, I agree. I mean, as someone who gets words put in my mouth all the time, and the critics, accusing you of this sort of dietary zealotry, it's like, I've never even actually said anything like that. But at the same time, there's people that will take it up and they'll say, well, all vegetables are poison, and how dare you, eating all carbs are poison. And I'm like, look, I mean, we have glucose in our body for a reason. Glucose is not poison. I mean, if it was, we would all be dead, because, even the strict of us still have a blood glucose of 60, 70, milligrams per deciliter. It's kind of crazy stuff there. How are things going with the book with Eric Westman? And did you guys get much response from that?
As far as I know, it's all been positive. If there have been some negatives, I haven't seen them. I think we did what we set out to do, which was write the book that we would have wanted if we were brand new to this. Like, because it is so overcomplicated now, and everybody makes it sound expensive, and you have to buy all this fancy kind of food. And we wanted to make it very clear that all you really have to do is just stop eating so much carbohydrate and tinker from there. But it's all been pretty positive. I'm trying to think if we've had any real negative. No, it's been good. I don't know what our next project will be. My thyroid, I want to do a thyroid booklet, but I say booklet, like not a book, but just a little guide for people, just like with some general education. Other than that, I don't know what my or our next big sort of low carb project would be, but the book has been really well received, I think.
Yeah, I have not, I have not actually presented at any conference, well, at least not in person. I've done a couple of virtual ones, but it seems like, since this sort of pandemic shut everything down. I mean, I remember, I guess it was in 2020, I was slated to do like 6 international trips and speak. And since that time, it's been like nothing really going on. How have you given a talk since then? And how has it been? Is it back to normal, or what are your thoughts?
No, I've done a lot of, not a lot. I did a few virtual events this year, like just a couple of, online summits and videos and stuff. And I was supposed to be in San Diego in person, and I didn't go, but they had it. So I do think those events are starting to open up. I don't have anything scheduled for the rest of the year yet. I hope something comes along, but it hasn't yet. I'm guessing that 2022, things will be pretty much back to normal. I hope.
Yeah, no kidding. And I wonder, just, and maybe you don't want to talk about this, but, um, we've got this pandemic. We have people that are scared to death. We're not addressing sort of the host health, metabolic health. Does that frustrate you in any way that it does me?
Yeah, it definitely, I see two sides of it though. This is definitely something that should be in the national conversation. Why was the US hit so hard? Now, there's a lot of reasons why, totally unrelated to everybody's individual health status. But certainly, if things like type 2 diabetes, hyperinsulinemia, all that kind of metabolic stuff makes you more susceptible to getting infected and more likely to have a worse outcome if you get infected, then why aren't we talking about how to not have these problems or how to make them better? And that I think should be, and Asim Malhotra's banging this drum really big in the UK. So I think that is a huge thing, but I also think that those of us who know about this aspect of metabolic health, we can educate people and we can talk about this as a huge national failure without the personal shaming and the personal, oh, well, you're this and if you weren't so sick and if you didn't have diabetes, because the fact is that was most of us a year ago or 5 years ago, before any of us found this way of eating, we were overweight or diabetic or hypertensive. And so to judge someone that maybe is exactly where we were 2 years ago or 5 years ago, it's not, we can educate and we can bring attention to how important it is to reverse these health problems without having a lot of personal attack against the people that are still there. Do you know what I mean?
Oh, absolutely. Yeah, there's no reason to do that. I mean, you can say, look, this is a problem. Here's a way that you might work for you to fix it if you want to try. What I think doesn't work is giving away a bunch of donuts and fast food and that type of stuff to encourage people to get vaccines. Whatever your stance on vaccines are, that's probably not the right message. And I think I saw, and I don't know if it's true or not, but there was a study looking at Americans on average gained something like 29 pounds over the last year, which, I mean, we don't have 29 pounds to gain as a country. I mean, that's something,
I sure
and as
don't.
you know,
Yeah.
once you get into a position where you gain a lot of extra body weight or body fat, you get in this sort of negative vicious cycle where you can't get out of that, and you kind of set these people up. And I saw something where among children 5 to 11 over the last year, something like 23% increase in obesity rate in that cohort. That's like 2 decades worth of obesity, expansion done in 1 year, which is, just horrible for those little kiddos that are, going to be, I mean, because many of them will never get out of that. Many of these kids that start off obese will spend their entire adulthood obese and suffering, with the associated illnesses, diabetes, hypertension, cardiovascular disease, dementia, autoimmune disease, cancer, on and on and on. And so we've kind of created that. And to me, there's no end of frustration. That's basically, when you look at the numbers, that's 7 or 6 million additional kids that are now obese that would not have been before, it's just kind of crazy in my view. But anyway,
It's,
I know what. Oh, go
yeah,
ahead, Amy.
it's alarming because even if they do get out of it, I was chubby as a child, and I feel like I'm going to have to fight it my whole life. I will never have the body of someone that has always been naturally slim. And not that it's a difficult fight, but it's something I'm always going to have to put deliberate effort into. And I think these kids might end up in that position, maybe not, but some of them will end up in that just constant battle to keep the weight off.
Yeah, and obviously life is a struggle anyway, regardless. Even if you're not fighting with weight loss, you're fighting to do something. And I don't know if have you conquered the peanut butter, or what was it, the nut butter thing? I remember a couple of years ago.
Thank God. Yeah, no, I haven't touched peanut butter or peanuts or even anything fake peanut flavored in 4 years or so, because it's been a while. And I wish that I knew what it was that flipped that switch one day that I just was done. Because if I could apply it to like other bad habits, not even just with food, but with other bad habits I have in life, like, oh, and after deliberately trying to break that for so long, one day I just stopped. But thank God. And pork rinds too. I have a red light food list of foods that, like, even if they're low in carbs, even if they're 0 carb, I can't have them in my house. Pork rinds are one of them. I just can't. Now, is it better to binge on pork rinds than on something sugary? Yeah, but it's still not good for somebody my size to eat a family-sized bag of pork rinds in a sitting. I cannot.
I was always, pork rinds tend to be mostly air in my view. And there's now something you may know.
They're not filling at all.
Yeah, they're not. I mean, I think they make good crusts if you're going to have like a quote unquote breaded option. You want it to be low carb. And there's actually, interestingly enough, there's now beef rinds, which I was kind of skeptical, but somebody sent me some of these beef rinds, and they taste very similar to pork. I mean, didn't know what to expect, but it tasted almost exactly like a pork rind. Now, I talked to the guy and I said I was pretty impressed with that, because I was expecting, I don't know what cow skin tastes like. I wasn't expecting
it to be. Is it the skin? Is it?
Yeah. It's just the skin. They normally throw away, stuff they normally throw away. And so they're turning it into, a viable product.
I have had chicken rinds. I've had chicken rinds. They're okay. They're not as good as pork rinds, but they're okay.
Yeah. So anyway, for those people that are allergic to pork or don't eat pork for religious reasons, they have beef rinds. I can't remember the name of the company that does that now, but that's pretty interesting here. So you're in North Carolina. I think I might be going to North Carolina maybe in a month or so for a visit to visit a ranch out there, perhaps. But somebody asked me about doing something with this ranch, and I said I would be happy to help out. So, are you still doing it? Because I remember you spent some time working with farms. I remember in Virginia, I think. Are you still involved in that at all, or what's
I was working at a farm here too until I think I quit around earlier, maybe like February or so. I stopped, or January. I was working at a local farm here about 30 minutes away, and it was a mixed species. They did beef, we did pork, lamb, poultry, and eggs. They did turkeys around Thanksgiving, and they had a lot of produce too. We had covered hoop houses so we could grow produce all year long too. And it's I'll tell you what, food, I know people are aware that food prices have increased, for all these various reasons, but even with the increase, we still spend so much less on food than a lot of the rest of the world does. And you have to know that, like, cheap food is cheap for a reason. Somebody somewhere along the supply chain is getting treated unfairly, whether it's the animals, the farm workers, the truckers, even people that are transporting the stuff to the store, the farmer. Like, it's I'm not, like, I understand that there's budget concerns and people are really struggling, but at the same time, it's not that food is expensive now, it's that it has been artificially cheap. If people talk about like a grass-fed steak being expensive, well, how much would a box of cornflakes cost if we stopped subsidizing corn? When you're paying $10 a box for Frosted Flakes, maybe that steak doesn't look quite so bad anymore.
Yeah, I think statistics, I mean, if you go back to maybe it was like the 1920s, it was something like 30% of the household income was dedicated to food. And now it's, maybe until recent times, it was something like 5 or 6%. So we've had a tremendous reduction in the amount of food the average person spends now. maybe going forward, we'll see people are saying, well, hey, I don't really need a new car this year. I can delay it a year. Maybe I don't need the extra shoes or purse or clothes or, whatever sports equipment, and we're going to put more on food. Hopefully, hopefully that would make sense. Interestingly, the United Nations is meeting this month to determine maybe you're aware of this, determine the goals of planetary agriculture, and clearly one of the big concerns is they're going to put the kibosh on the meat and dairy industry, and they're going to and that's going to have actual real world consequences, and it's going to be policies for those people that follow the UN. Some of the countries that do are going to make this, what I consider the best nutrient dense food available, more difficult to obtain. And so we're going to have people that are, I just think our metabolic health problem, obesity problem, is just going to get worse by another. If you can imagine, it can get worse. But I just think you're going to see the obese are going to be more obese, and we're going to be seeing, it's going to be that Wally world. I don't know if you ever remember that little cartoon where everybody's going on their hover chairs, drinking their synthetic food.
No, I totally agree, and I tend to stay out of the politics because it's just not like, I don't want to be a lobbyist. I don't want to. I more enjoy educating people, because when somebody knows, then they can make a different choice for themselves. But if we're going to get to the point where choice is not available, or choice is more limited because of those laws or regulations, it's a huge problem. But it's also, why is it that in so many other parts of the world, especially really, really like poor, underprivileged areas, meat is valued, it's revered, it's like this luxury, like, oh, if we could only get some meat. And here people are, not this group, but like people are deliberately not eating meat and not eating these things. And I don't know how you feel, but like, I really suspect that there's so much debility and so much like loss of quality of life with sort of subclinical nutrient insufficiencies, not an overt deficiency, like you're not walking around with rickets, you're not walking around with scurvy, but iron deficiency anemia is not something that should exist in the United States in 2021, and yet it's rampant. And like B12 deficiency and choline and all this stuff that it's alarming, because so much, look at all the anxiety medicine and depression medicine and all this stuff that people take, when what if you just needed like a little bump up in certain critical nutrients, and it's because you're living on cereal and granola bars that you're not getting it. And women, especially, again, I hate the stereotype, but women who need these nutrients the most are the ones that are most likely to avoid the foods that are richest in this stuff. It kills me looking at young women, especially women of reproductive age, teenage girls who don't eat red meat, or who just, it's heartbreaking, because those problems are going to get worse.
Yeah, it's interesting, and I don't know if you saw this. I post this. I always do this because it's part of my bias. But there was a study that came out in I can't remember what it was, but they looked at Ubiquinol, CoQ10, basically, and saw a pretty significant deficiency among people that are on plant-based diets, vegans, vegetarians. And one of the interesting things about Ubiquinol is you can get it. It's more bioavailable in meat and so forth, and you can get it to some degree in plants. But the dietary intake of that represents a tiny fraction of where our circulating levels come. Something like 95% of it is synthesized endogenously, and so the problem is that supplementing is not really going to make a difference. And so some of this endogenous production is dependent on HMG, co-reductase and B6 and so on and so forth. And so we're seeing these secondary deficiencies coming from primary source, and you can't supplement your way out of that. It's one of those things where, like I see with perhaps even vitamin D, where people are, cholesterol is a precursor for, a lot of the sex hormones, including vitamin D, which is another hormone technically. And, the supplements often fail, and you have to take these massive amounts of supplements to get a transient bump. And so maybe it's just a deficiency. And as you said, scared of eating fat. And we've had this, we've seen the the downstream effects of, 5 decades of policy of fat is bad, it's evil, we shouldn't eat it. And maybe this is just another one of those things.
It is, but I think I don't know if fat isn't quite as demonized, but the red meat is. And I don't know what your thoughts are. I think I've seen you post some studies on this, but because people still write to us about the red meat and colon cancer issue. And even like some of the bigger organizations have said, okay, like unprocessed, fresh red meat, blah, 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 is not a problem, but they're still demonizing things like salami and bologna and sausage and bacon. Meanwhile, even those quote unquote processed meats also have in my opinion, negligible association with colon. Like the whole thing is nonsense. And it just, like, it's not the meat at all. And when we were talking about the budget before, I know I'm preaching to the choir here, but if you really do have very limited funds, get the cheapest meat you can, because that's still going to be better than eating the sugary crap. Like, get the cheap stuff. You don't have to spring for grass finished if you can't afford it. But you're also better off eating bacon and sausage and salami than eating a bowl of Lucky Charms cereal. And so it's nice that at least some people are finally starting to say, well, no, it's not the unprocessed meat. It's not meat of any kind. Like, just stop it already. It kills me.
Yeah, I mean, obviously I've been beating that drum for years now. And I think, as I look into it more and more, I think, certainly people just fixate on the fact that the World Health Organization, whose name has kind of been dragged through the mud over the last year for whatever reason, for various reasons, but they say that it's a 17% relative risk increase, which absolute is like a 1%, so it's not even that big of a number. But beyond that, then you say, well, what else contributes to colorectal cancer? And then when you start looking at the other factors like obesity, central obesity, hyperinsulinemia, chronic inflammation, certainly inflammatory bowel disease, and you plug those numbers in there and you see it's not 17%. These are 200, 300, 500, 3,000% increases. And you're like, well, if I eliminate all those things, which very often it happens on a meat-based diet, everything goes down by 200, 300, 400%, and you're saying it goes up by 17. What's the net effect? And it's something that they don't seem to get that argument. It's like the only thing that causes colorectal cancer is meat, and yet there's vegetarians and vegans that get colon cancer not infrequently.
Right. There was that study that came out, I think just this year in January, that was about the women's health study or something. It was a female subject only, but I think it would apply to men too, where they compared I don't remember if it was relative or absolute risk, but the increase in risk for coronary heart disease. And they had type 2 diabetes, insulin resistance, smoking, hypertension, and insulin resistance, I think, was 6 times greater risk. Type 2 diabetes, 10 times the risk compared to somebody that doesn't have diabetes. And high total cholesterol and LDL were like 1 point something. It was like nothing. It was a joke compared to the impact of diabetes and all the metabolic syndrome stuff. And it's like, and we're still looking, even being sedentary, even lack of physical activity was really, really low on the list compared to the hypertension, the diabetes, and the insulin resistance. Like, we are in the twilight zone. We really are.
Yeah, I think women's health study, I think it was like a 50,000 person cohort. And, I remember that study well. I think the relative risk for cardiovascular disease with elevated LDL cholesterol is like 1.32 was the odds ratio, but then diabetes was 10 times the amount.
Yes.
And then from a laboratory standpoint, LPIR, lipoprotein insulin resistance score, was the big discriminator there. It was something like you had an 800% increase in hazard with an elevation of that one, whereas LDL cholesterol is like 1.3. And so again, when you're going out, what are the things that actually make a difference in the real world in these people? And we're seeing clearly that diabetic pathophysiology is huge for heart disease and a host of other things as well, as you're aware of, certainly with dementia, as you pointed out very nicely.
It just kills me because, like, looking at this isn't new, this was buried. Doctors like they were writing about this in the 50s and 60s. And if you look at, Gerald Reeve, and the guy that coined the term syndrome X or metabolic syndrome, in the 1980s, he was writing about this, like in the height of the low fat thing. Reven was like, I think it might actually be the carbs that are a problem. Or he wasn't huge on a low carb diet, but he was definitely not, he was opposed to demonizing fat because he thought it would lead to an increase in the amount of carbs people were already eating. And he knew that it was the insulin driving most of this. But it's just like John Yudkin, in the 1960s was talking not just about sugar, he was talking about all these cardiovascular disease, gallbladder problems. And it's like we just totally swept this aside. All these brilliant doctors were just ignored.
Yeah, I mean, you see, I guess it's been forever. I mean, but we're seeing sort of censoring of dissent. And as you're aware, I mean, it's with COVID response. It's nutrition to a degree. And we're seeing it. And I honestly think that what we're going to see is more and more people like your ability to talk about eating a low carb diet may be impacted. I mean, we may get to that point where it's not part of the prevailing message, and because climate change, and of course cows are solely responsible for climate change if you listen to some people, which is absolute nonsense, but climate change disproportionately affects certain racial minorities, and therefore eating meat is now somehow racist or something. I mean, this is a nonsense that we're going to be seeing, and it's already starting to trickle in, and we'll see that. And so I'm just hoping that enough of us will sort of figure out a way to continue to share this message. Because like you said, you don't want to be political, you just want to share information. But what happens when you're not allowed to speak? And that's something, the frustration I've dealt with here recently. And it's I can tell you it's fairly frustrating, but unfortunately you just kind of continue to press on. What else was I wanted to ask you about? Oh, okay. Alzheimer's. So any updates on the Alzheimer's stuff? I mean, have we seen any further validation of some of the stuff you were talking about? Are we making progress in that? I know Dale Brett isn't out in UC, maybe SF. I can't remember where exactly is, but what's the latest in the Alzheimer's world? Or do you still have
Dale Bredesen has a couple of new books out. I haven't read them yet, but I have not seen any progress in terms of these messages reaching like the average doctor's office or even the average neurologist's office, but there are more and more papers coming out. I think more and more people are starting to recognize that this is an issue, like the blood sugar, insulin, metabolic syndrome connection. They even call it they call it metabolic cognitive syndrome. Like if you go on PubMed, there's papers that have that phrase in the title, metabolic cognitive syndrome. That's how strong like these links are now. And it's nice to see more studies, and there's even more studies coming out on ketogenic diets or even just MCT oil and MCT drinks for the brain. But I have not seen it yet sort of trickle down to the average doctor's office, but I think that's going to take a longer time to happen.
Yes, and maybe you caught wind of this. I think it's been maybe, I don't know, 3 to 6 months ago. There was a drug for Alzheimer's that the FDA passed, and despite 11 of their 12 scientific advisors saying do not pass this drug, it is not effective. It may even be unsafe. But because some people are so desperate to treat that, they pass this potentially dangerous drug, and yet they won't talk about diet. What are your thoughts on that?
Yeah, honestly, I blocked it out so much that I forgot about it till you mentioned. Of course, this drug is an anti-amyloid drug, and there's an entire chapter in my book about why the amyloid hypothesis is wrong. It's like the cholesterol thing and heart disease. We've been looking at this one thing, trying to lower it and lower it and lower it, except lowering it very often does nothing to help the person with the disease. They still die from a heart attack. They still die from a stroke. And it's the same thing with Alzheimer's. We have these drugs that do reduce the amyloid. The person still declines and declines and dies. Well, whoop-de-doo, they died with less amyloid. So it's like you said, people are just desperate for anything. But it's a nightmare is what it is. I can't believe it got approved, and it's going to do nothing. I mean, every other amyloid drug, they know it's a failure. They know it doesn't do anything. So
Yeah,
it's
not to mention it's I think $56,000 a year on top of that, or some ridiculous amount of money. And I think even in their clinical trials where they were testing it, they didn't really see much of a response. I mean, it was just like, why are you approving this medication other than, I don't know. It's kind of crazy to think
yeah.
about that. Karen's asked me if you could speak about a little bit about, I don't know if you're still involved in this, but the Adapt Your Life Academy. I know I gave a lecture for Eric, back. It was the last live lecture I did back at the beginning of
Right.
2020.
Oh, I remember Long Beach or somewhere. That was the
Right,
last, right
right.
before everything got shut down. Yeah, so thank you for asking. It's adaptyourlifeacademy.com. It's Eric Westman is one of the founders of the company, and we are creating online courses about low carb and keto diets. I have a course that is starting next week. So if at adaptyourlifeacademy.com, it's called The Stall Slayer, and it's based on a little book that I wrote that's about breaking fat loss stalls on low carb or keto diets. And even if you are following a strict carnivore diet, I think it could still be helpful for you or for someone else. I know a lot of you are coaches. So if you have clients that are, it's because it's about the food, but I also have a whole lesson on thyroid. I have a lesson on medications that could interfere with weight loss, all that stuff. But I think the academy is going well, and it's a blessing and a curse, right? Because like we were talking about at the very beginning, it's a shame that we have to create courses to help people understand how to eat this way in a simple, affordable, sane, rational way. But it's more business for us, because the more confused people are and the crazier it gets out there, the more demand there is for voices of temperance. I mean, that's not the right word, but voices of like, no, it's okay to get your meat from the regular store, and it's okay to do so it's going well, but it's almost like a shame that it's going well. It's going well because there's such a demand for this kind of education. But at least we can put it out there in a way that we think is trustworthy and science-based.
All right, I've got another question. Emma's talking about, and I know you've dealt with this before, the ApoE 3-4 people, and Brett says stay away from saturated fat or meat, and she's saying she's on carnivore and her autoimmune condition is much better that way. Should she be concerned? And then I guess a secondary question, I know we can do imaging of the brain in younger people, and it'll show a predilection for developing cognitive decline or dementia early on. What are your thoughts on saturated fat, the ApoE system, and then is there a way to test it to see if it's working back? And you say, hey, I'm developing Alzheimer's and it's subclinical, or how do we do that?
Yeah, so the first I want to say that there's a lot we don't know. There are a lot of unanswered questions. So anyone who's making it sound like they know for sure the effects and the genotype and the blood types and all that, no, they don't. They might have a lot of answers, but we don't have all of them. In my opinion, so I really do respect Dr. Bredesen, but I think he's a little too down on the saturated fat. And I think in the absence of eating all the carbs and all the garbage, saturated fat in the context of a meat-heavy diet is probably fine, because just like with the heart disease study, the biggest factors in Alzheimer's that I can see are the chronic hyperinsulinemia and Alzheimer's is a problem of glucose getting into the brain and the neurons being able to take it up and metabolize it to give them energy and keep them alive. And I think okay, before I go there, the ApoE4 thing, what is the research based on? The research that makes it look bad for an ApoE4 to eat a lot of saturated fat is based on people eating a standard Western type diet. They're not eating diets of 10% carbs or 5 or 0% carbs. They're combining whatever fat they're eating, saturated or not, with all the sugar and starch. What we have unfortunately, as Shawn knows, we have almost no research in people eating zero carb diets or very, very low carb diets and higher saturated fat. So I think, and so when we say that like a high cholesterol level or a high LDL is bad for somebody with ApoE4, again, that's in the context of somebody that probably has prediabetes or hyperinsulinemia or, you know, the early stages of metabolic syndrome. I personally would not be concerned about saturated fat if I was ApoE4, but I also tell people, we don't know for certain. If you want to hedge your bets, eat more seafood, eat more poultry, eat, you know, if you include vegetables in your diet, make them the non-starchy ones. You know, I don't think you have to hedge, but if somebody wants to. And then the other thing, what you asked about the measuring, yeah, the way that they can sort of determine somebody's risk, I guess is the best word, like somebody's predilection for developing a cognitive problem, is they actually, it's a PET scan. Now, just like with cancer, they give you that glucose and they can see where the glucose is going, so they can see where the tumors are. They'll give you glucose and they can measure how much of it or how fast the brain takes it up. And if, you know, they have, I guess, what's considered normal or normal for a certain age, and then they can see if you're lower than that or much lower or where you fall. And if you all, you know, people at risk for Alzheimer's already have a depressed rate of brain glucose uptake in their 30s and 40s. So by the time they're 50 or 60, of course, now there's a problem. But I think, I mean, that's not something you would get done at like the average doctor's office. It's a special scan. And I don't know of anyone really doing this outside some of the research studies, but they will have people repeat that test and see if it's getting any better. And I think in Bredesen, I don't know if he's done the PET scans or he's just done MRIs of the brain, and he can see that it just, the physical matter of the brain is regrowing, for lack of a better, because it'll atrophy and shrink, but then he can see that it comes back too after however many months or years on his protocol.
Yeah, and you pointed out the context of, you know, the stuff with saturated fat in the standard American diet, and I saw recently, and I don't know if it's verified, I'll have to verify this, that only something like 5% of the saturated fat in the U.S. diet is actually coming from meat. Most of it's coming from processed foods and you know, perhaps maybe some dairy. But so it's interesting to say that, you know, maybe, you know, again, saturated fat may be a marker for a junk food diet, you know, and it's just like we see fruit and vegetable consumption as a marker for affluence and wealth. And you know, so we have all these other confounded factors. But if that's true, that most of the saturated fat is coming from donuts and, you know, and cake and garbage, which it very well could be, but looking at the food consumption, you know, you have to sort of say, wait a minute, maybe it's all the other processed, you know, processed flours and grains and sugars and all the pure garbage that we eat.
Yeah, I could not agree more. You know, every time they talk about a high fat diet or red meat, they show this like stock image photo of a burger on a bun with fries on a soda. And it's like, okay, yeah, let's blame the, you know, 4 ounces of beef there. Let's ignore the 150 grams of sugar and starch. Like, but that's where we are. Or sometimes they'll show pizza when they talk about like a greasy diet or a high fat. I'm like, are you kidding? Like all I see is bread there, made bread with some cheese on it. But that's where we are. People are, they don't have time to dissect the messages. They don't have time to look and say who benefits from showing me this particular image versus any other they could have shown me. And frankly, there's a lot of very lazy journalists. This also is a byproduct of the 24-hour news cycle and the clickbait and the competition for likes and shares, because the more extreme or the more sensationalist something is, the more attention it gets, no matter how wrong or inaccurate it actually is.
Yeah, absolutely. It is kind of disturbing to read the headlines and then, and then actually read the science behind those headlines. It's not even, sometimes it's not, you're not even convinced the journalist actually read the article or
totally.
or any.
I see it all the time. Yeah.
Well, Amy, we've gone through an hour. It's been nice catching up with you. It's always great to see you and speak from you. You're always fun to talk to, and I always appreciate your perspective. Tell folks, how to find out more, where you're located, or if you're still on social media and you haven't been kicked off yet, or
Yeah,
if you're.
I'm still hanging on for now. I'm on Twitter. My username is Tuit Nutrition, TUIT Nutrition, and that's also the name of my YouTube channel. And check out the Stall Slayer Masterclass. It's on adaptyourlifeacademy.com. I know that's a really long name, but what else? I have my website is tuitnutrition.com, but it is in desperate need of overhaul. I've got to redo the website, but you can contact me through there.
Perfect. Well, thank you for spending your Labor Day. I hope you have a great Labor Day, and hopefully you get a nice.
Enjoy the brisket. I hope it's good.
I'm sure it will be. I'll take some pictures of it and put it on the usual places when I get it done. So thanks, guys. Everybody have a great day. You guys enjoy the rest of your Labor Day, and we'll see you guys tomorrow. Bye-bye, everybody.
Take care, everybody.
Thanks, Amy. Bye-bye.
Thank you.
Join Revero.health for a 30-day free trial to get access to live Q&A with VIP guests, social community meetings, member discounts, low-carb healthcare providers list, forum, workouts, monthly challenges, early access to podcasts, recipes, carnivore diet guide, fasting guide, shred guide, and much more.